Okay, I'm back. It's Rebecca again with Gordon Marketing. Hopefully you are smarter now than you were when you first tuned into my first video. And again, the reason why I do these videos, this is something I have been studying for months. This isn't something you're going to watch once and you're going to feel confident and you're going to be like a new cowboy out there blazing. You're going to need to watch it again and again, take notes, show it to your staff, whatever. So use this, become smart. Heck, you might even want to show this to your consumers, which is fine as well. You might have to pay me royalties for that. I'm not sure. I'll let you know. All right, let's recap from video 3. Option 1, marketplace. Option 2, private. Again, you're going to be looking at your self-employed folks who are going to enter into this private. I cannot stress this enough. Right now, you have got to get a plan. You need to be getting in front of self-employed people. You need to be doing meetings right now at libraries, at your chamber office. You need to start branding yourself as the reform expert. Nobody knows what's going on. I'm on my chamber's board of directors, and I'm amazed. I am, but I'm not. It's confusing. Nobody knows. So if I come out, right, and I have all these answers, people are going to want to buy from me because they're going to think Rebecca is super smart, she's super tapped in, she knows the options. That's what you have to do. So you may have an old block of business. Get them together. You may put an ad in the paper calling all self-employed people. 87% of all business in this country is done by self-employed small business owners. 4 to 12 employees. That's the sweet spot. That's all of America. Get an ad in the paper. Get an ad at your chamber office. The Chamber of Commerce in your city is always looking for ways to give back to the chamber members who are all, chances are, self-employed. You need to act now on this. Small groups, remember I said your sweet spot is 2 to 50. The reason why I said that is because if you have more than 50 employees, you will be penalized if you do not offer affordable health care to your employees. That's a key word, is affordable. What the government is calling affordable is that their health premium cannot be 9.5% of their income. It can't be more than 9.5% of their income. So if you are an employer and you might have a different levels of employees, you might have some minimum wage. Well, if the plan you're offering is more than 9.5% of their minimum wage, you are subject to a penalty. And that penalty is $2,000 per employee. These are for groups of 50 and over. Now, one thing that you'll notice is with these small groups is that they're going to give you 30 free ones. So for example, if you have 55, and I'm going to draw up here, if you have 55 employees and let's say you decide not to offer any coverage at all, right? Because you can do the math, what you're currently paying and what a penalty is. This is how the math breaks down. You have 55 employees. You get a freebie of 30. So now you're down to 25 employees. Well, if you decide to opt out of offering any coverage at all, that's your bottom line. 25 times 2,000, which could be less than what you're spending in premium. A lot of options, folks. A lot of ways to look at this. It's like an onion with different layers. I'm going to jump back to our small group, 2 to 50. There are no penalties. So the sweet spot of America is that, 4 to 12 employees. There are no penalties. It's now a guaranteed issue market, so the handcuffs come off of the employer. And that's true. Employers were handcuffed. Now the employer can say, look, I'm going to give you X. And you could take that X based on what your income is and go to the marketplace. And maybe the subsidy is going to be a better option, and I'm going to raise your income $1,000. Or, boom, we're going to go to the private sector. Maybe that's a better option. And math doesn't lie, right? Numbers don't lie. If you add it all up, if it's less expensive than what your small group is paying, it makes sense. And 9 times out of 10, it will make sense. So, opportunities, start blasting the small groups. Get in front of the employers. Your job is to have a plan. Your job is to speak with conviction, to say, look, these are your options. I've already thought about it. I've done the research. Just listen and let me help guide you. You'll write a lot of business. You will write a lot of business if you really beef up on this stuff. Stick with me. All right, number 3, we said no coverage. This is going to be the folks now who have no coverage. A $95 penalty, who cares? That's no big deal. The penalties do go up each year. But the big deal is this. If your client does not buy by March 31st, they're going to hit a term called lock-in. Which means if they have that heart attack, we'll say in May, they're out of luck. They cannot opt into the program until the next open enrollment, unless of a life-changing event. So what's a life-changing event? You get married, you get divorced, you have a baby, you adopt a kid. There's like 10 life-changing events. Pretty standard stuff. But the big deal is you're locked in, you know? That's the penalty. Game over. If something happens to you in that amount of time, that 6 months outside of open enrollment, you are up a creek without a paddle. So what is your option then? A scheduled benefit plan. I love Assurance scheduled benefit. It's called Health Access. Now, the big thing with that plan, a scheduled benefit plan doesn't cover everything. It's a schedule. It's like looking at a menu. You know exactly what you're getting. Anything above that amount, you're on the hook for. But this plan does provide some key coverages that are very important. One is a network, a PPO. Why is this so important? The power of repricing. I had twins. I know. How is that possible? But I have 4 kids, and my youngest 2 are twins, twin girls. Normal maternity, piece of cake, normal delivery, right? I'm in the hospital less than 2 days, $15,000. I live in Indiana, so our cost of health care is very affordable. $15,000. Once all my bills went through my network, got repriced, all those negotiated rates went down to $7,000. So even if you put your client in a scheduled benefit, right, maybe bridging them to the next open enrollment, you are giving them one of the most important tools to every medical policy. It's a network. You're also giving them in-hospital coverage. So if they're in there for a sickness, they're getting $2,000 a day, and if they're in there for an accident, they're getting $4,000 a day. And it has $1 million lifetime max. We protect ourselves from the big things, right? We don't care about the sniffles. My allergies are killing me now. I don't sweat that. I'm going to sweat breast cancer. I'm going to sweat a heart attack. I'm going to sweat the high dollar items that could really rock my world. And that's the type of lingo you need to have for your clients. Yeah, these will also have doctor visits. They're also going to have drug coverage. They're also going to have outpatient emergency room. And we'll go into more of this. There's videos out there on a Health Access that I've done. But this is an amazing option for you. These plans are not part of health reform, so they still pay the Great Commission. Number 1 question, do they count as credible coverage? No, it's not major medical, so your client will still be penalized. $95 a year, which breaks down to like $8 a month. But it is going to provide an amazing bridge, amazing security, until they could opt back in if they choose to do so. There's a lot of options here. Again, think of that metaphor, the analogy of an onion. There's so many layers. Thanks for tuning in. Look for more videos. Give us a call. We are traveling to at least 15 states to put on our dog and pony show, how reform is going to work, our role in this. Let me know where you are, and if I can make it work, I'll come see you. Have a good one.